Audio Jungle.
Hello, dear viewers. Welcome to the online pregnancy school. As I always say, pregnancy should be a time of joy and not a time of anxiety. And that is why it's always a pleasure to come your way with the online pregnancy school. My name is Dr. Linda Vanotu. And for some of you, I'm sure you've been following us and have learned a lot from all the episodes that we have brought you. For those who have not yet known about the pregnancy school, this is the online pregnancy school, and I encourage you to visit my Facebook on Dr. Linda Vanotu and watch the previous episodes. You will learn a lot. If it happens that you have any questions on any of the ones that you have gone through previously, don't hesitate at all. Please send me a WhatsApp message on 059 242 0625. 059 242 0625. This program is proudly sponsored by Promise, where we are concerned about the wealth and the health of people, because health is actually wealth. It's also sponsored by Vanotu International. We are into the development of people. It's again sponsored by Reverse Tap. If you have a party, you have a wedding, and you want to serve drinks, like our own local drinks, I'm sure you know them, call us, and Reverse Tap will give you the best. You know that in the season that we are in, with me wearing my face mask, I've already washed my hands. And if you have to wash your hands, you have to use the best soap. And that's why I recommend to you Bubble Gold Liquid Soap, manufactured by Samzara Ventures. Dear viewers, stay tuned. We'll be back.
Audio Jungle.
Welcome back to the program. Once again, this is the online pregnancy school, and my name is Dr. Linda Vanotu. Today we're going to talk about a very important topic, which is dear to the hearts of many people, which in the past was a concern to a lot of people, but I'm sure these days you are not so frightened because you don't have to be. We're going to talk about HIV. We'll talk about HIV and then specifically go down to HIV in the pregnant woman. And to do this with me is the program director for HIV in Ghana. His name is also a colleague, Dr. Stephen Ayisi Ado. Doc, you are welcome.
Thank you.
This is
good
the
afternoon
online
to you.
pregnancy school.
Yes.
Yes.
Thank you.
And first of all, I want to know, if we say that the HIV program, what does it entail?
Okay, so thanks a lot for the opportunity to be here. The HIV program really is a public health program which sits under the Ghana Health Service, the Ministry of Health. The reason why there is a program for HIV is because HIV is one of the health conditions of public health importance.
Okay. When you say public health importance,
like all other conditions, like malaria, tuberculosis, and even COVID now,
yes,
it's of public health importance because it goes beyond just affecting an individual to the general public.
Okay.
We said that there was a pandemic which started in China. Now it's in, it started like just an ordinary illness.
Yes.
It spread everywhere.
Yes.
So HIV is like that. It started somewhere. It's everywhere in the world. As we speak now, about 37 million people.
What? 37 million?
Yes, are living with HIV.
In the world?
In the world.
That's a lot.
Million, yes, okay. In Ghana, it's about 342,000 people.
In Ghana alone?
Living with HIV.
Wow.
In Ghana alone. So you cannot overlook it. It's of public health importance.
Okay.
And why is it important? Because it affects the population. And the final outcome is death. Now, so as healthcare providers, our interest is to protect the public from illnesses and diseases and their attendant complications. The attendant complication, the ultimate is the death.
Yeah.
So if we are going to prevent that, then it means that we are keeping people alive. So the HIV or the National AIDS Control Program is a program responsible, okay, to lead the national response to HIV in Ghana. And the ultimate goal is to prevent and control HIV in Ghana.
And that is possible.
That is possible because based on the data and where we have come from, and the way things are going, and the targets that we've set for ourselves, the whole world, we've decided that we should be able to end this epidemic by 2030.
That is the HIV epidemic.
HIV epidemic
by 2030.
At that time, we should be able to declare that it's no more of public health importance. It's possible that people may have HIV, but it will not be in proportions that will be so significant. And the impact would have been mitigated significantly to the extent that it becomes an ordinary thing. So that is our target 10 years from now.
It's only 10 years.
Only 10 years.
But we will get there.
We are hopeful because to do this, we have to put in place some other strategies to be able to achieve, let's say, 90 by end of this year.
Please, what is 90?
So 90 means that, I said that there are estimated over 342,000 people living with HIV. If you want to make it of no importance, the people must know their status.
Yes.
So 90% of them, at least, should know that they are HIV. The purpose is that once they know, then they can get treatment. So 90% of those who know should be put on antiretroviral therapy. This medication, when you take, suppresses the virus, prevents it from multiplying. So that now the virus becomes undetectable in your body. Which means that you cannot then transmit. So of that 90, we want 90% of them to be at least virally suppressed. Once that happens, it means that we call something undetectable is untransmissible. It means that if the virus, after 6 months, 1 year of you taking your medication, is suppressed, the likelihood that you can give it to somebody is zero. Once we achieve that in all these numbers, then the general population are free. People will marry, people will get into all kinds of relationships, but they will not transmit. Now, those who already have it, with time,
so Doc,
will grow.
What you talked about, the 90, it means that the general public, right? So it's not those who already have it, who know that they have it. But are you talking about the general public, that anybody within the public who has it, if you take 100 of them, 90 should know that they have it. So that means that people should get tested. Is that what it means?
That is what it means. It includes, therefore, those who already know they have it. And those who don't know that.
So anybody
those that who know, we are happy. And we have put them on treatment. But the problem or the challenge now is those who don't know.
That's a serious
So that is why they must know. So we have programs that will help them to know. So that once they know, they cannot be put on treatment. Because unknowingly people may be transmitting. And today we are going to talk about pregnant women. The baby who is in the mother's womb does not know anything. The pregnant woman may be carrying it and therefore can give it to the baby. So also when we talk about the general population, it includes everybody, males, females, non-pregnant and pregnant, children, everybody in the general population must know. But we are 30 million in Ghana. If you start testing everybody, it may not be sustainable.
You can't.
We're talking about COVID now. Many people if you want to test everybody, it's not sustainable. So you have to be strategic in your testing, helping people to know. Our lessons tell us that there are some groups of people who are at risk and easy to target for testing.
Now, when you say at risk, what does it mean?
Okay, so it means that by their nature, biology, whatever they are involved in, behavior, and all that, they are at a higher risk of getting HIV. And there are some that we call key populations. Now, men who have sex with men, the risk of transmission is very high. So in them, the HIV prevalence is 18%.
What percent?
18. So if you take 100,
18 of them. Okay.
Female sex workers,
Mhm.
by the fact their behavior, they have multiple clients. But
Yeah.
so they too, if you take 100 of them, about 5
Have it.
have it. Now, if you take people who have sexually transmitted infections, in other words, they have other things like gonorrhea or syphilis and all that. Now it's about 5%.
Hmm.
Okay, 5 out of 100.
Yeah.
Then when you take, let's say, pregnant women,
Yeah.
the last time we did it, 2 out of 100
Yes.
are positive. If you take people who have tuberculosis, 19 out of 100 have it.
Have
So if you are testing, you have to take all this into consideration. And so we're going to try as much as possible to reach out to the people who are easy to reach.
Hmm.
If you take, for instance, men, okay, who are not anything, I mean, they are about 6 out of 100 in
Yeah.
our general care. And then we notice that if you take the partners of people who are HIV
Yeah.
positive already, we are getting around 24%.
Wow.
So our strategies are determined by these groups. Because if you go and put it in, let's say, a place where they are not likely to be positive, children who have never had sex
Yeah.
and all that, they will all be negative
Yes.
and will not benefit. So in addition to making sure that everybody we don't know gets to know their status, we want to be strategic so that our testing will be efficient.
Okay.
Then we can read them quickly, put them on treatment, and then they will have viral suppression. And once we break the chain of transmission, we'll be able to achieve our goal of epidemic control.
Wow. Viewers, today we are talking about HIV, and we'll zoom into HIV in the pregnant woman. My guest is Dr. Stephen Ayisi Ado. He's the program manager for HIV in Ghana. And the goal is that by 2030, we should be able to get HIV to the level where it is no more a public health importance. And yes, he has explained to us what it means. He's also explained to us the 90. So that means that if you take 100 people, 90% of them should know their status. Those who are positive, 90% should be on treatment, and those who are on treatment, 90% of them should have what is called the viral suppression. When that happens, then the transmission, giving it to another person, becomes very, very, very low, almost zero. And that is where we can say that Ghana, we have reached a certain level. And it is not just for this country, but all over the world. This is what we are trying to do. The figures he has told us, about 350.
Yes, about 343,000 people.
Over 340,000 people in Ghana are living
HIV.
with HIV. That means that they are doing a lot of work, and we have to support to ensure that we get Ghana to the level where we should get it to. Look, before we go into the pregnancy, can we talk about the adolescents? You know, some of them, young children, were born with HIV. They have grown up. They are now at a certain age, 16, 14, 18, 20. Now some of them are concerned that, is this something that they should be so worried about that they cannot live normal lives?
They have very serious concern and legitimate concern. But fortunately now, based on our lessons, because one of the things we do as a program is always to be learning.
Yeah. And
we noticed that it was necessary to focus on adolescents, because whereas they were taken care of when perhaps they were born, let's say most of them got the HIV from their mothers,
yes,
who were not on treatment. They were taken care of, they started, and they were also put on treatment. But we started losing them when they reached the age of adolescence and they started school.
Okay.
Why did it happen? Because now when adolescent is a child and an adult, that's what it means. At the time when they were HIV, they didn't know. to explain it to them even that they have HIV was an issue. And therefore, to get them to be responsible, to take medications that to keep them alive was a problem.
Okay.
Now, as they become adults, they are also developing features like adults. They want to live like anybody. They want to have relationships and all that. And there was a difficulty. If you told them that, look, you are HIV, so be careful and all that, they felt restricted. So even when you put them on treatment, after a period, they question themselves. Why must I continue?
Exactly.
I have friends who are not taking
Yes.
medication. And they start questioning their parents. Some of them even believe that their mothers are wicked because they give them
Because they don't understand.
yes, HIV.
Oh, okay.
So how come? Yeah, because why is it that I have other people don't have?
Yes.
So you, my mother,
You
you
gave
were
it.
wicked and you
Oh.
gave it to them. So it's a problem, and some of them decide that they go into depression. They will not even take the medications. Now, when they start going to school, they have to be taking this pill every day. Now, which of us, when we were in secondary school, were
We
taking
want to do
medications
that.
every day? So even they have to hide to take it. And once, sometimes it's not ideal to hide because school, you need to go to, wake up at a time, go to assembly, do a number of things.
Yeah.
It's not always easy. So sometimes they default, they don't take their medications and then they get worse. Some of them have to hide medications in broken down vehicles and all that in school.
Wow.
Now, it was not easy to take care of them because the caregivers in school, the teachers, not all of them were trained. So if you go tell any of them that this child is HIV and therefore do this and that, it may be the beginning of, let's say, stigma
Yes.
for the child. So until we were sure that a teacher was aware, nobody would know. Now, if they finish their medications, they must be coming to the clinic for follow-up.
Yes.
So exit, they have fixed exit.
Yes.
They cannot be coming every day for exit because they are HIV. That also will expose them.
Yes.
So it was very difficult taking care of them.
Wow.
To the extent that certain health workers have to even meet them sometimes under a tree or something.
Oh.
So all these contributed to why adolescents were being affected and died. So they had legitimate concern. But we've taken note of this,
Okay.
and we are rolling out specific interventions for adolescents.
That is very good.
And the main one is what we call the provision of care through the community adolescent treatment supporters.
Okay.
The main problem is how do you facilitate their care? So health workers are there, they will come to the people, sometimes they don't come. The health workers are trained to counsel them, and the moment they go to school, they are other places. Nobody is in charge. So we're getting a group of people. Some of them are HIV positive, but they are trained
Okay.
young people. And they will be like supporters, and they will help these adolescents.
Yeah.
They are making sure that they are taking their medication. They are encouraging them for their follow-up. They are giving them psychosocial care,
Okay.
motivating them. Some of the questions they ask,
Yes.
they are the people who will answer it for them.
Okay.
And then give them hope. Let them live positively. Then when they're able to transition through the adolescent age, they become adults, they own it. And now they know that HIV is not a death sentence. As long as they take their medications, they will be well. And so they are a special group for us. And we need to make sure that they survive because if you are an adolescent, you are HIV, it means you will live longer with the disease.
Yes.
And taking this medicine for life,
It's not easy.
it's not easy at all, so they need to be
Wow.
encouraged. Compared to diabetes and hypertension, people get it in adulthood.
Yes.
So even if they have to take, compared to adolescents,
It's a shorter.
it's a shorter duration. So this is a special group,
Wow.
and we are very concerned about it.
Well, dear viewers, this is the online pregnancy school. Today we are talking about HIV, and we're going to talk about HIV in the pregnant woman. But it was necessary for us to get a clear understanding of what is happening in that space. And it's good that there's a special program for the adolescents. So if you are listening to us and you have a daughter, you have a son who has been diagnosed with HIV, please don't think that that is a death sentence. No. And today we are here with a program Manager for Ghana, Dr. Stephen A.C. Addo. If you have any question about HIV in yourself, in your child, or any question at all about HIV, please don't hesitate. Send me a WhatsApp message on 059 242 0625. 059 242 0625. If you have any questions or you want to know anything about it, please send me a WhatsApp and we will get in touch with Dr. Isiado and he'll be very happy to answer those questions for you. This program is sponsored by Promise Ghana, Vanuatu International, Reverse Tap, and Sanzara Ventures, manufacturers of Bubble Gold Liquid Soap. My name is Dr. Linda Vanuatu, and my guest for today is Dr. Stephen A.C. Addo, the Program Manager for Ghana for HIV. Doc, now we're going to talk about HIV in the pregnant woman. Why is it a concern?
It's a concern because of what Kodiabi said. If you educate a man, you educate an individual. And if you educate a woman, you educate a nation. A woman is more like a channel for life.
Yes.
It's through the womb of a woman that people come into the world. And once you talk about a woman and a child, it means there is another person, a man, behind this woman. And therefore, in fighting HIV, if you do not focus on the woman, you'll be missing a lot of important people who are linked to the woman. Right? So in Ghana, we have considered the woman as a priority population. So we talk about females. Because if you take an adult gets HIV deliberately or let's say on his own. Because if you look at, we said that there are modes of transmission of HIV. Almost 80% is through sex between a man and a woman.
Okay.
An adult. 15% from mother to child. And then the remaining is through infected products of blood transmission or sharps, like the blades and all those things. Okay. Now, for adults, they deliberately decide to have sex. I mean, if you can tell, I mean, how does pregnancy come about? Two people must meet. It's consenting adults. In a few cases, there's a rape or forced relationship. We did a study in sex work, HIV and the tourism industry. And we noticed that the female sex workers charge two fees. One for people who have unprotected sex and those who want to use condom. And the feedback we got was that men would prefer to pay higher to have unprotected sex.
You don't say.
So sometimes I joke about it and I say people literally buy HIV. They are willing to pay higher for HIV. The last time somebody had sex, they will make a lot of effort in getting. But when it comes to a woman who may give it to a child, the baby is innocent. Remember that a woman is also at the receiving end. If a man decides that he will not use a condom, it's sometimes very difficult for the woman to resist the condom. We know in society that when it comes to ability, paying, resources, access to resources, the men have more access.
Yeah.
And therefore the tendency or the likelihood that a man will pay a woman to have sex, even if she doesn't want, is very high.
Yes.
In the society, men are supposed to be the head and the women. So sometimes even standing up to somebody, to insist on using condom is not very easy.
Yeah.
So a lot of women are very vulnerable in many ways. Culturally, they look up to men who take care of them, so they dictate to them.
Yeah.
Even in a sexual relationship, you look at it, always the men are on top of the women. The women don't even, sometimes. So, and you take the biology. One of the things that can facilitate transmission is surface area, okay? In the semen, in the woman's semen. But if you take a man, the man's penis, the surface area is just limited compared to a female.
Yeah.
If a man discharges into a female, the woman holds this fluid for a long time.
Yes.
And the likelihood of exposure is higher for the woman compared to the man who only comes out.
Yes.
Now, one of the things that facilitate transmission is bruises, okay, whether there's injury or not. In any sexual relationship, if there will be bruises, the likelihood is that the woman will have it more because
So bruises are like small
sores.
Yeah.
The woman's female reproductive tract is more vulnerable and more fragile and more prone to these sores.
Yeah.
Okay. And the virus will travel through these sores.
Meaning whether there's a break or a
Even
sore.
whether there's a sore.
And there's virus, then the virus will go through that. Yes.
So you can tell that women here are many ways prone or more vulnerable. So if you take currently as we speak now
Yeah.
in our program, about 80%, 79 are women of the people
Of
who are
those who
positive
have
HIV.
in Ghana.
Majority.
Ladies and gentlemen, this is the online pregnancy school. Today we are talking about HIV. We are learning a lot. Please, if you're a young lady, you are a young man, listen carefully that HIV is still with us and it is preventable. If you're a young girl, you are not married, please don't go sleeping around because we just heard from Dr. Isi Adu that if you have sex, there are breaks. You have like little sores. And if this gentleman has HIV, the virus will easily pass through these little sores. And in Ghana, if you look at the number of people who have HIV, over what percentage?
I'm saying about 79 of those.
About 79. So if you take 100
Yeah,
people with HIV, about 79 of them are females. So the ladies, we have to be careful. And he's explained to us that it's not so easy for the young woman, for even the elderly woman, to negotiate for the man to use a condom. So please, we have to be very careful. Doc, let's go.
Okay, so to be able to manage this, that there are some 15% of people, that is children, who can get it automatically from any woman. We need to protect that 15%.
Yes.
And so we need to protect the women.
Yes.
So we have a strategy, 4 prone strategies. Now, for a mother to give HIV to a baby, 2 conditions must exist.
Okay.
First of all, the mother should be pregnant. That woman should be
Yes.
pregnant. And secondly, the woman should be HIV positive.
Okay.
So out of this, we crafted what we call the 4 prone strategy to prevent mother-to-child transmission.
Okay.
The first thing is that if you're able to make sure that only one of the conditions exists, there will be no transmission to a baby. So the first strategy is to make sure that all females in reproductive age group are free of HIV.
Okay.
Yes, because if a lady is free and
She
gets
cannot
pregnant,
transmit it.
she cannot transmit it.
Yes.
As I told you, about 98% of pregnant women in Ghana are negative.
Yes.
Okay, so that 2%, we must make sure that it doesn't happen.
Okay.
So primary prevention, the general education we are talking about, using condoms, A, B, C, D, all that, will help everybody, the women who will one day become pregnant, to be negative at least. So that when they become pregnant by any mistake, it's only the pregnancy, they'll give birth to a baby who is free of HIV. Now, but you can't think about only the woman, because nobody gets up and becomes pregnant. A man must be there.
Yes.
So make sure that the men are also negative. So the primary prevention is also targeted at men, so that if the general population is all free of HIV, men can sleep with women, they can get into any sexual, and they can be pregnant, but there will be no HIV.
Okay.
All right, so the first strategy is to make sure that everybody in the population are HIV free.
Okay.
So that is that we are preaching the ABCD, they are still relevant, abstinence, using being faithful to your partner, because multiple sexual partners increases the risk, and condoms. And the condoms used should not be just one-off. It should be correctly used, consistently used, and continuously used within an act.
Okay.
It's always sometimes people starting today, they withdraw. But the fact that I knew you today, I thought you were straight, I used it. If I come again, and I don't use it next time. I've only postponed the exposure. Okay, so that is it. And we are saying that young people should delay early sex. So that is the deal. Alright, so all these are still very relevant.
Okay.
And we are hoping that we'll be able to increase this education as we go ahead. Okay. So that is behavior change. How people can change behavior, they will reduce their risk. So you cannot talk about it without talking about the men who have sex with men. Because some of them are bisexual. They have sex with men, but they also have female partners. So we also are hoping that they will use condoms, and we are going to introduce now what we call pre-exposure prophylaxis for them, so that when they take the medicine to suppress the virus.
What is prophylaxis?
Prophylaxis is giving some item, medication to somebody to take to protect the person from potential infection.
Okay.
So you want to give the person, you are not waiting for the person to get the infection, but you are giving it to the person so that it will reduce the likelihood.
Like immunization.
Like immunization.
Okay.
So we are going to give it to high-risk people so that it will reduce the viral count, and then they will not give it.
Okay.
Now, so if you are able to achieve that, then it means that to a very large extent, people can get pregnant. No problem.
Okay.
But despite all these efforts, some people will still get HIV. So the next strategy is now to prevent pregnancy unwanted, unintended, amongst persons who are HIV positive.
Okay.
Because if I'm positive, the only other condition left for me to give it to a baby is when I get pregnant. So that is the next thing. So rolling our family planning services for young people who are women with reproductive age groups so that they don't get pregnant. Because if you don't want to be pregnant, you shouldn't get pregnant. We should help you. So,
but doc, does it mean that if I'm HIV positive, I shouldn't think of becoming pregnant?
no, you can get pregnant.
You can get pregnant.
You can, but it should be planned.
Okay.
Because once you know something about it, you can do something about it. If you
Yes.
don't know it, then you can be risking yourself and other people.
Exactly.
So we are not saying that if you are in fact, now in Ghana, by the grace of God, it is even good. People can get pregnant, they can have children who are negative.
Wow.
Based on what we have done, people can take medication and then there will be no transmission to a baby.
That is what we want to do. So, dear viewers, this is the online pregnancy school. My name is Dr. Linda Vanotu, and my guest for today is Dr. Stephen Ayisi Ado. We are talking about HIV, and specifically HIV in pregnancy. That is what we are on now. And he's telling us that if you are a woman who is HIV positive, it is not a sentence that says that you cannot become pregnant. You can become pregnant, you can have a child. And he's now going to tell us what is done so that a woman who is HIV positive may not transmit this virus to the child. So Doc, what happens?
So thank you. So no matter what you do, some people will be positive and they'll be pregnant.
Okay.
So once they are positive and pregnant, now what do you do to protect the baby? So now you give the baby a prophylaxis, I explained.
Yes.
Something so that when the mother takes, the likelihood of giving it to the baby is almost there.
Okay.
And that is what we call the antiretroviral prophylaxis. So now for every pregnant woman, like all others who are HIV positive, the moment we identify, we will be given treatment.
Okay.
Now, but before this, you need to identify the person.
Yes.
So as a policy, every pregnant woman who comes to the hospital has to be tested for HIV
Okay.
routinely. It's given to them, it's a routine offer.
Doc, do they do it there and then? Like if I come today, I'm tested, or I must go and do it and come
No,
back?
you are tested. Come today now, everywhere that's available, you are tested.
Okay.
And the moment you are positive, now we arrange for you to get your
And is it done only once?
only once.
Okay.
Some
But
people
why
do it
only once?
elsewhere, and then they are referred to come and do it again. That's what they do it too. But when we say once, it doesn't mean that we just test. We have an algorithm. We have steps.
Very
A
good.
person is only confirmed as HIV positive in Ghana when you do a first test with a particular test.
Yes.
a rapid diagnosis test, a second one, before we can confirm that you are HIV positive.
Okay.
Now, very soon we are introducing a third one,
Okay.
because in a place like Ghana, where prevalence is very low, there's a likelihood that we may be picking false positives.
Okay.
So the WHO says that we should use 3 tests to confirm that somebody is positive.
Okay.
That all that will be done within the same time, one
Alright.
sitting before you go.
Oh, okay.
And once you are positive now, we are even now trying to provide antiretroviral medication the same day, even for you, the pregnant woman, so that you don't go away positive and not taking medication. Because time is of essence.
Yes.
The pregnancy period is limited. So once you want to prevent transmission from mother to baby, the mother must start taking the drugs early, so that suppression will occur quickly. Because there are 3 ways that a mother can give it to the baby. When the mother is in the baby is in the womb,
Yes.
that one is very low, about 5%, up to 5%. And it's actually dependent on whether some procedure happened, and it's a breach, and then it's a mixture of blood, whatever. But the highest is during the labor and delivery.
Okay.
You know, during that time, baby is coming out.
Yes.
You see it's all that blood contamination. So that can be up to 25% or more. Okay. And then during the breastfeeding period,
Yes.
it can be actually transmitted through the breast milk. So we start giving the medication early, so that by the time it's delivery labor time, the viral load is even very low.
No, how early?
It's undetectable. So within the first trimester, I'm sure
Yes, we have
within the
discussed
first
it,
15
yeah.
years, so you
Yeah.
discussed it. So within the first 13 weeks of your pregnancy, in fact, any time that we test you, you come to the ANC for the first time, we test you for HIV.
Yes.
So it's dependent on when you come. If you came earlier than 13,
That's why it's good to go
it's
early.
good to go early, so that we know early and we start you early.
Exactly.
But at any point in time, even if you come late
They will still
in
check.
labor, we will check and then so
Yes,
that we put
give you the
medication.
treatment. That's great.
So once we do that, we monitor you throughout and then monitor you after birth. You will continue to take your medication for life. When the baby is born, within 24 hours, 40 days, we give the baby to something. That is also another prophylaxis.
Okay.
So we are protecting double the baby, so that the baby will not be, because the baby will be breastfeeding still.
Yes.
So there's still exposure. The baby will be taking this medication for a period until we do some tests to confirm the baby status. It's called the early infant diagnosis. And when we do it and the baby is actually positive, we actually put the baby on full treatment. But when the baby is negative, we will repeat that test 9 months.
Okay.
And if the baby is not positive again, we say that this baby is free of HIV. But the mother will continue to take the medication.
Wow.
So this is to ensure that at least we reduce mother to child transmission.
Okay.
We have a target.
Okay.
We must get to 2%, below 5%. As we speak, multiply.
Okay.
So that now the virus becomes undetectable in your body,
Okay.
which means that you cannot then transmit. So of that 90, we want 90 of them, percent of them to be at least virally suppressed. Once that happens, it means that we call something undetectable is untransmissible. It means that if the virus after 6 months, 1 year of mutated mothers, please let me repeat. You know that in Ghana, as a policy, every woman is supposed to breastfeed
Yes.
exclusively as much as possible for 6 months and all. But when it comes to HIV, this is major, it is key. We
100%.
cannot compromise on that. Now people say that, okay, if you say that breast milk is the factor, why don't you say then that
Don't give
all
at all.
HIV positive mothers should not give at all? We did a study and we realized that it was not easy. If the woman doesn't have to breastfeed and the baby must survive, you need about 66 cans of NAN1. What is the cost of one?
They can't buy.
They can't afford.
So they add more water.
The baby will not get good nutrition. Those who claim that they can, they start, and then someone
They
on the
realize
line, they
that
start mixing.
It is not so simple.
That is worse. But then the value of the breast milk, the quality is so good that even if you get other exposures, once the person is exclusively breastfeeding, the likelihood is that the baby will be healthy.
Yes.
That is why we encourage exclusive breastfeeding amongst pregnant women who are positive.
Wow. Dear viewers, this is the online pregnancy school. Today we are talking about HIV, and we are zooming on to how we can prevent the transmission from the mother to the baby. But we've also spoken about the general public and what the program, HIV program in Ghana, is seeking to do. We will need everybody's support. If you are a man, your wife is pregnant, please let her go to the antenatal as quickly as possible. As soon as she misses her period, let her go to the hospital, because there are so many things that will be done for her, including testing for HIV and starting treatment as soon as possible, so that that baby that is inside the mother's womb will be protected. My guest for today is Dr. Stephen A.C. Adu. He's the program manager for HIV in Ghana, and he's taking us through what the program seeks to do. Doc, so the pregnant woman who is HIV positive, does she have to be paying for the medications?
Not at all. If anybody claims or demands payment for treatment for a pregnant woman, it should be reported to us. It's free. Testing is free. And then antiretroviral medication is free.
Okay.
Because we don't want the cost to be a barrier.
All right.
And these children are innocent, so we need to protect them. They are future
And the
generations.
treatment given to the baby is also free.
It's also free.
Then that is
Except
good.
that we don't have the treatment centers everywhere.
That's what I was going to
So
ask.
people will have to travel. And we are doing everything to actually expand access.
But in
We
the
have about
government
500
institutions,
ART sites,
Okay.
but about 4,000 PMTST sites. So what we have done now is to train midwives to give the medication.
All right.
So very soon, all the places where people go and deliver, there will be treatment there,
Okay.
and they will be given the medication so that they don't have to travel.
So if I was going to the antenatal in one place and I moved to deliver in another place, what should I do?
Hopefully, there should be a formal transfer so that those where you are going to, they will know that you are on treatment or not. Now, if that place they are not, then we have to arrange for you to get a medication.
So that means that if I am an HIV pregnant woman and I'm moving to another place, I should talk to my midwife
Talk to the midwife.
or my doctor so that they will link up with
Then they will link
wherever I
up
want
and they
to
give
go.
you proper transfer, not just
Yes.
referral.
Okay.
They will link you to the nurse so that your care will not be interrupted.
Yeah.
Because you should not stop taking medication. You should continue. Because the medication you are taking now is for yourself, your own health, and for the baby. And even when the baby grows and we declare the baby negative, which is happening these days, that people are happy, you yourself, you need to be in good health.
Yes.
Because you may come and deliver again, you may get pregnant again. And now our data is showing that because of survival, pregnant women are coming back. Women who deliver about 4 times, 5 times,
Hey.
they are coming. Because in the past, they will abandon the baby because they thought that automatically the baby will be HIV. But that is not the case. Now with antiretroviral therapy, they are negative, so they are motivated to come.
Okay.
All right, so it's very important to now support these pregnant women. And you said something, the men support them. That's where the fourth strategy, the first one is primary prevention.
Yes.
Second one, avoid unintended pregnancies among persons. And the third is giving antiretroviral therapy to prevent mother-child transmission. The fourth is providing supportive psychosocial care to this mother and all the people around. So now, what do? This pregnant woman who is come to the clinic needs support.
Yes.
She only was tested positive because she got pregnant. But who impregnated it was a man.
Yes.
So sometimes they beg us when we get to know that they are positive, that we shouldn't tell their husbands.
Oh.
Because the husband will throw them away. He will not take care of them.
When they made them pregnant.
And yet, it's likely that they gave them even the
Yes.
infection. But because she came there because of pregnancy and was tested first, the assumption is that she is the one who has the virus. So that care is also important, and that is the education we are giving them. We are bringing in queen mothers, opinion leaders, church leaders to encourage men not to abandon their women, because it's possible it's the men who brought it to the woman, and the woman only got to know because of pregnancy, and that is a blessing. Because walking about without knowing is worse than knowing and taking an action. And I told you that we are doing something called index testing.
Yes.
The woman, once we test, we go and test them, man, and we have noticed that about 24% are positive. So actually, the woman is a blessing to you, the man, so you should support.
Exactly.
And then all the family members should also support, because gone are the days when if you are HIV, it's a death sentence. Nobody wants to talk to you. Nobody. These days, I ask people, choose between COVID-19 and HIV.
They will choose HIV.
They like HIV. No. Yes, and I ask people, choose between HIV and Ebola. They like HIV. Because if you have HIV, you will live. In fact, HIV people now, once they are taking their medication, they are well, they will survive better than even somebody who has a stroke and somebody who has any of these chronic diseases. If you take the top 10 diseases in Ghana, now HIV is not in it. HIV is maybe in top 10. But in the whole world even, HIV is dropping because now of people are surviving because of antiretroviral therapy.
Wow.
Right. So there is hope.
There is hope.
Right? And there's hope for the unborn child. There's hope for people who are living with HIV, as we work very hard to get also a cure and all that. But for now, even the treatment is helping, and we are encouraging as many people as possible not to hide, because
That is
the
very
hiding
important.
and the stigma and discrimination,
Should be a thing of the past.
it worsens the situation. I was very surprised that even COVID people are stigmatizing. Now,
You know,
thank God that HIV now, people are willing to come out, declare, and that is very positive. And I get very encouraged, because gone were the days when people thought that we should quarantine them, we shouldn't come into the public.
I remember.
And pastors would not like to bless people who are married, who
Yeah.
want to. And we are saying that no pastor has the right. It's the right of anybody to marry. So we encourage people to know their status before they marry, as premarital testing. But if we get to know, don't deny anybody, because love is bigger than HIV.
Yeah.
I believe so. I have cases of people, one is positive, one is negative. A woman is positive, a man is negative. They are married, they have children who are negative, because they love each other. Today is Sunday, so let me say that isn't it the case that the Bible says that greater love has no man than this, that is to lay down his life for his friend. And therefore, if I'm HIV and my partner is negative, and the partner loves me, is this love not greater than the ordinary love? Is it not rather a blessing? So I think that we should rather encourage this, because if you then deny the people and stigmatize them, you are sentencing them to death.
Yeah.
And some of people just committed suicide
Because of
because
that.
of this. But today we have people who are HIV, young people, they are well, they are fine, they are contributing to the economy, they are very stable in their relationship, they are children who are negative, and they are making great impact in our society. So let's stop the stigma and discrimination. Let's support the women, the men, and everybody around them. They are not a time bomb. They are not a death sentence. They are living. They will live even longer than others.
They will live longer than other people. That is the message for you. This is the online pregnancy school. Today our topic was on HIV, and then we zoom in onto the pregnant woman. We've been told the four prongs that are being used to address HIV in Ghana. And one thing is that, please, the men, we cannot overemphasize this. When your wife is pregnant, please support her as much as you can, because that baby needs you to stay healthy whilst inside and even come out healthy. It's very important. Doc, before we go, we are in the COVID season. Is COVID worse, or is it more in the people who are HIV positive?
Okay, so the data shows that COVID effect on people in terms of infection and all that, everybody is prone, because the mode of transmission is through droplets and all that, contacts and all that surface. But the effect in terms of the complications and consequences when you get it is worse in people who have reduced immunity. It means that their defense is reduced. There are many things that can cause a weakened immunity, and HIV is one of them. In fact, HIV, the main problem there is that when you have the virus, it weakens your immunity. So you are prone to all kinds of infections, which are called opportunistic infections. That's why people, tuberculosis can kill them easily, diarrhea and all those things. So as much as possible, every infection like COVID can then kill the person who is living with HIV easier than others. But the only way to avoid that is for that person who is HIV to have good immunity. And the only way is to be taking the medication.
Okay.
So if you are positive, don't be afraid. As long as you are on your medications, antiretroviral therapy, you are adhering very well. Your immunity will be good. You may even get COVID, but it will not push you.
Okay.
What we have done during this COVID period is that in addition to the education for people to maintain the protocols and all that, we have supplied a lot more of the medication.
Okay.
So that people who are positive will get not to 1 month, but they'll get like 3 months, 6 months. That means that you can be at home and take your medication for 6 months. You don't have to be coming out frequently. You don't have to be visiting the hospital that much. And then you are better, so that minimizes the risk of you getting HIV.
Okay.
So these are the policies. In addition to that, we are encouraging them to eat well, the usual basic exercise plus good nutrition. We're taking all the things that will keep you well, the supplements and all that. Eat healthy diet, take enough water during this period so that your immunity is boosted and preserved. Then you can be protected from COVID-19.
Okay.
But we are looking beyond COVID-19 because there are other conditions like tuberculosis and other conditions that can also kill the people living with HIV. So if you adhere to your medication,
You'll be fine.
then you'll be fine.
You will be fine. And that is from Dr. Stephen Aisiado, the program manager for HIV in Ghana. Doc, just before we go, the baby who is born to an HIV positive mother, is that baby smaller? Is the baby in any way disadvantaged compared to a woman who doesn't have the HIV?
Okay, so the studies have shown that when a mother is HIV positive and didn't take a medication at all, didn't take anything at all, the viral load is very high. And the likelihood of transmitting to the baby is very high. It's highest. So that baby is disadvantaged compared to the other person. The other issue is that because of the high viral load, some of the times it affects their development. So a baby will have problems with its development when it's born. And because of the potential illness of that baby, the baby will also be feeding well. And then it affects the development of the baby. But all these are reversed when the mother receives correct intervention during pregnancy. So that's why it's important for a woman to even ask for HIV test when you go to AS. So that when you are tested positive, we give you treatment. Then that will protect you and the baby. Once you are on medication, your baby's outcome is the same as somebody who is not HIV positive. They will grow well, they have enough weight, they are good normal weight. They also, you will feed them breast milk, everything, they grow normally like any other baby, and they survive as long as they get all the interventions that we give them. The problem is if we don't know and we don't give them the prophylaxis, then we cannot prevent transmission in those babies, the babies. They are called HIV exposed infants. They are not positive. So we have to know so that we give them the medication as prophylaxis and try to prevent them from getting. So that by the time they finish breastfeeding, they are free. In that case, they are only disadvantaged if we don't know. But if we know, then they get their interventions, then they are like any other baby who's
Yes, pregnant women, your babies will be like any other baby who is born. But it is up to you to go for the antenatal, to have the test, and also take the medication that is given to you. I believe that that is what doctor has emphasized over and over and over again, that if you take the medication, you'll be fine. Your baby will be fine. You'll also be fine. This baby will grow well. You can breastfeed. And if you have any challenges, of course, just go back to the hospital. Talk to the midwife. Talk to the doctor. If there's any reason why you have to travel from where you are to another place, let them be aware and let them link you up to wherever you are going so that you can continue with your treatment. These days, it is not a shame. It is not something that you should be afraid of, that if somebody knows I'm HIV positive, they will shun my company, nobody will come near me. And if you are doing that to someone who is HIV positive, please, it is not right. That is also a human being, and you have to treat everybody very well. Today, our topic was on HIV. We talked about HIV in general and then HIV in the pregnant woman. We have heard so much. My guest is Dr. Stephen Adu, the program manager for HIV in Ghana. Doc, thank you very, very, very much. Before we sign off, is there any last minute advice for the general public?
I want to thank you very much, and I want to emphasize once again that HIV is no more a death sentence. If you have HIV, you can live long like any other person in society. The government of Ghana and all other stakeholders are working very hard to make sure that this happens. It is our target that we'll be able to achieve epidemic control of HIV in the next 10 years. We need your support, we need your cooperation. It is no more a death sentence. So please feel free, access services, ask for HIV services, and you will be offered. If anybody is HIV in your family or in your community or society, do not discriminate against that person. Do not stigmatize that person. Because you can be the next victim, but you don't have to be a victim before you identify with the people living with HIV. There is hope for the future. Let us cooperate with the health service and everybody and the program. And I believe that very soon, Ghana will become a country free of AIDS. The next generation will be a generation free of AIDS. Thank you very much.
Thank you very much. The next generation will be a generation free of AIDS. And that is what we want to leave you with. Once again, my name is Dr. Linda Vanotu. This is the online pregnancy school which was sponsored by Promise Ghana, Vanotu International, Reverse Tap, and Samsara Ventures. And I want to say a big thank you again on behalf of all of us to Dr. Adu for explaining to us what HIV is being, how it is being handled in Ghana, and what they expect us as the general public to help to do. The next generation should be free of HIV and AIDS. See you another time. Bye.
Audio Jungle.